Hyperkinetic disorders. These emotional disorders. Look at these pictures, brain factors and other factors. A detail going on. Introduction. Hyperkinetic disorders are a group of neurodevelopmental and neuropsychiatric conditions characterized by excessive involuntary movements or motor activity. These disorders often manifest in childhood but can persist into adulthood, affecting motor control, behavior, attention, and impulse regulation. The most well-known condition in this category is attention deficit hyperactivity disorder, ADHD. But other disorders involving abnormal increased movement are also included. A definition. Hyperkinetic disorders are conditions that result in excessive, rapid or uncontrollable movements, along with symptoms related to attention, impulse control or cognitive functioning. The primary feature is hyperactivity, often accompanied by difficulties in focusing attention or controlling impulses. ADHD is prominent example, though other movements disorders such as Tourette syndrome are also classified as hyperkinetic. Types. 1. Attention deficit hyperactivity disorder. It is characterized by inattention, impulsivity and hyperactivity. 2. Tourette syndrome. This involves motor and voice tics, often presenting as repetitive involuntary movements or sounds. 3. Chorea, characterized by irregular, jerky and involuntary movements affecting the limbs and facial muscles. 4. Dystonia, causes abnormal muscle contractions resulting in twisting or repetitive movements. 5. Myoclonus, sudden, brief, involuntary muscle jerks. 6. Huntington's disease, a genetic condition that results in progressive motor dysfunction, including chorea and cognitive decline. Causes. The exact causes of hyperkinetic disorders vary depending on the specific condition. Some common causes include 1. Genetic. Many hyperkinetic disorders have a genetic components, especially ADHD and Huntington's disease. To neurotransmitter impulses, abnormal dopamine and norepinephrine regulation in the brain are thought to contribute to hyperactivity impulsivity. 3. Brain injury or trauma. Structural abnormalities in the brain due to injury or prenatal factors can cause hyperkinetic symptoms. 4. Infections. Viral bacterial infections affecting the central nervous system may trigger hyperkinetic symptoms. 5. Environmental factors. Lead poisoning, prenatal exposure to alcohol or tobacco, and low birth weight may contribute to the development of these disorders. Risk factors. 1. Family history. A strong genetic predisposition for conditions like ADHD and Huntington's disease. 2. Prenatal exposure. Maternal smoking, alcohol consumption or drug use during pregnancy increases risk. 3. Premature birth. Preterm infants are at high risk of developing hyperkinetic disorder. 4. Brain infections, meningitis, encephalitis or other brain infections can damage areas responsible for motor control. 5. Trauma, brain injuries, particularly those affecting the basal ganglia, are linked to hyperkinetic movement disorders. Complications. If untreated, hyperkinetic disorders are lead to 1. Academic underachievement, particularly in ADHD, difficulties with attention and hyperactivity can interfere with learning. 2. Social difficulties, impulse control issues can lead to problematic relationships and social isolation. 3. Risk of accidents, hyperactivity behavior, especially in children, can lead to injuries. 4. Emotional and behavioral issues, anxiety, depression, and oppositional behavior can develop due to frustration and challenges managing symptoms. 5. Progressive neurological decline, disorders like Huntington's disease can worsen over time, leading to severe motor and cognitive impairment. Pathophysiology. The pathophysiology of hyperkinetic disorders, particularly focusing on ADHD and other movement disorders like Tourette syndrome, involves multiple neurobiological processes. Here is a detailed step-by-step breakdown of the underlying mechanisms. 1. Neuroanatomical changes, dysfunction in key brain areas, prefrontal cortex, basal ganglia, cerebellum, responsible for motor and behavioral regulation. 2. Neurotransmitter imbalance, abnormal dopamine, norepinephrine and GABA signaling leading to impaired attention, hyperactivity and involuntary movements. 3. Genetic factors, genetic mutations and polymorphism affecting neurotransmitter symptoms and brain development. 4. Neuronal circuit dysfunction, disrupted communication with key brain circuits regulating movement and attention. 5. Cerebral blood flow and metabolism, decreased activity in areas controlling attention, impulse regulation and motor function. 6. Developmental delays, delayed maturation and abnormal synaptic pruning affecting brain development and function. 7. Environmental and epigenetic influences, prenatal and postnatal environmental factors contributing to abnormal brain development and neurotransmitter regulation. 8. Inflammation and immunodysfunction. In some cases, autoimmune or inflammatory processes affecting brain structures linked to hyperkinetic symptoms. This step-by-step breakdown highlights the complexity of hyperkinetic disorders with multiple interacting factors contributing to the abnormal motor and cognitive symptoms observed in these conditions. Signs and symptoms. 1. ADHD, inattention, hyperactivity, impulsivity, fidgeting, difficulty staying still and trouble focusing. 2. Tourette syndrome, involuntary tics such as blinking, grimacing or throat clearing. 5. Chorea, irregular, involuntary and unpredictable movements. 4. Dystonia, abnormal postures or twisting, repetitive movements due to muscle contractions. 5. Myoclonus, quick involuntary muscle jerks. Diagnosis. 1. Clinical assessment based on history of symptoms, behavior observation and detailed patient interviews. 2. Neuroimaging, MRI, CT scans may be used to detect structural brain abnormalities, especially in case of brain injury or neurodegenerative disorders. 3. Psychometric testing, ADHD specific test, example Connier's rating scale to assess attention deficit and hyperactivity levels. 4. Genetic testing, for conditions like Huntington's disease, genetic testing confirms the presence of specific mutations. 5. Electroencephalogram, sometimes used to rule out seizures or other neurological conditions mimicking hyperkinetic disorders. Nursing diagnosis. 1. Risk for injury related to impulsive behavior, hyperactivity. 2. Impaired social interaction due to behavioral symptoms and difficulty in controlling actions. 3. Ineffective coping related to frustration, anxiety, or depression from living with a chronic disorder. 4. Disturbed sleep patterns due to hyperactivity or involuntary movements. Management. 1. Behavioral therapy, particularly effective in ADHD, cognitive behavioral therapy, helps improve focus, manage impulsive behavior, and reduce hyperactivity. 2. Family support and education, providing families with tools to manage symptoms at home and create supportive environments. 3. Physical therapy for movement disorders like dystonia. Physical therapy can help improve coordination and reduce excessive movements. 4. Psychotherapy, addressing co-occurring emotional and behavioral issues such as anxiety and depression. Treatment. A. Pharmacotherapy. 1. Stimulants, medications like methylphenidate or amphetamines are effective in ADHD. 2. Antipsychotics used to manage tics in Tourette syndrome and chorea in Huntington's diseases. 3. Anticonvulsants, sometimes prescribed for managing myoclonus. B. Surgical interventions, deep brain stimulation, implanted electrodes stimulate brain regions in severe movement disorders. C. Lifestyle and environmental modification, structured environments and regular routines help individuals manage symptoms effectively. Psychosocial medicine. Hyperkinetic disorders impact not only the individual but also their social, emotional life. Coping with stigma, peer rejection, and emotional regulation difficulties is common. Psychosocial intervention focus on 1. Social skill training to improve peer interactions and communications. 2. Family counseling to address familial stress and develop supportive strategies. 3. Educational support, creating individualized education plans for children with ADHD to help them succeed academically. Prevention. While many hyperkinetic disorders such as genetic conditions like Huntington's disease cannot be prevented, Early diagnosis and management can reduce complications. Preventive measures include 1. Healthy prenatal care, avoiding smoking, alcohol, and drug during pregnancy. 2. Minimizing brain injury risk, using protective equipments in sports and seats belts in car to prevent head trauma. 3. Lead poisoning prevention, reducing exposure to environmental toxins. In conclusion, hyperkinetic disorders encompasses a wide range of conditions with motor and behavioral symptoms. Proper diagnosis and management, including pharmacological and psychosocial treatments, can significantly improve the quality of life for affected individuals. Early intervention, family support, and structured environments play critical roles in successful management, and especially in childhood onset disorders like ADHD. Thank you. Have a nice day.